And Supervisor Williams.
Well, I have some concern over the state not reflecting our current data. And it looks to me like week after week, we're told we should be on the watch list. We've hit the threshold, but the data hasn't been entered yet. To me, this looks like a 3-digit number that needs to be typed on a computer into a spreadsheet somewhere at the state. And I'm struggling because we've been telling the public, the state's been telling the public that we are making data-driven decisions. And yet our data is weeks old. We're not making data-driven decisions if we're making decisions based on data from 3 or 4 weeks ago. And I think there's a continuation of this pattern. The state is requiring that hair salons shut down. They can operate outside, they can't operate inside. Where is the data to show that hair salons in this county are creating cases? What I've seen is people in tight social gatherings, likely in houses' backyards, are causing spread. And as a result, we're shutting down the hair salon. We're telling them they can operate outside. A lot of salons can't operate outside. They're in locations where out on a sidewalk is windy, there's traffic. They would create more of a nuisance. And so we're putting people's livelihoods at risk. Why? Where's the data to show that we're keeping our cases low as a result? And I think we need to convey this to the state. I understand it's not our decision, it's not our local health officer, but we should make it clear to the state we have an expectation that where we have problems, we will address the problems. But don't allow social gatherings in one part of the county to shut down business in another part of the county. There has to be some rational basis. And I guess I would appreciate hearing from staff and my colleagues on this. Is it appropriate to give the state a little bit more of input about where we think the problem areas are in our county and what scaling back should look like?
If I may, through the chair, I understand clearly what you're stating, Supervisor Williams. I do know that our health officer, Dr. Doohan, has had multiple conversations with the state around the specific needs of Mendocino County, specifically around when they first came out and around the social bubbles and the social gatherings and support groups that we needed, and that she has been able to have multiple conversations with them around the differences in rural communities and what we need versus a more populated area and what we see as the community spread. She's had multiple conversations regarding the gatherings with them, with the state, and with both public health at the state level, as well as other entities that are looking at the coronavirus and the response within the governor's office. As to specific businesses, I can't speak to the governor's decisions on those businesses. I would agree with your statement that we have not seen spread from hair salons in Mendocino County. However, I know that the health officer is also working to be proactive in her efforts to be able to, if Mendocino County is placed on the watch list, to be able to show that we are being proactive in effort to collaborate and be able to resolve situations as quickly as possible to be able to minimize the impacts for Mendocino County and hopefully be able to resolve situations and reduce our numbers to be able to get off watch lists as quickly as possible as well. Currently, we are not on the watch list, you are correct, and it is certainly challenging to not have accurate data reflected at the state level of Mendocino County, and that's part of the reason we are having regular meetings. And when I say regular, it's really and truly we're having daily meetings, if not sometimes twice a day. Sometimes if they skip on the weekends, then we're having several other meetings to collaborate and make sure that we have all of the right partners on those meetings to try and rectify the situation.
And perhaps, or last question, perhaps I could hear from my colleagues. I think our staff is doing everything right, but I feel like we're performing surgery on the wrong patient. And I have this, wait a second, let's look at where the problem is and try to address the problem rather than being punitive to businesses that have nothing to do with the problem. Is it appropriate for us to mirror our public health officer's outreach with her counterparts at a political level? Should the county be drafting a letter explaining where our weaknesses are, where we see spread, and what we think the appropriate scaling back would be?
Well, I would say I'm in agreement with you, Supervisor Williams. I could see that it's certainly disconcerting to know that the state doesn't have the correct information or can't look at our webpage and see what we're seeing and make their decisions based on that. So to think that they're a couple weeks behind makes you wonder, where are they a couple weeks behind for the rest of the state too? And I would certainly welcome a letter like that saying, why are we, under these restrictions when you guys can't even get your act together? And where is the basis for all this? What's the data, as you say?
Mr. Chair?
Yes, Supervisor Brown.
Thank you, sir. I can also support a letter, but I'd like to ask Ms. Emery on these daily calls and daily meetings with the state, who's on those calls? Is it California Department of Public Health or Cal OES, Governor's Office? Who are you talking to at a state level?
I may through the chat. It is primarily California Department of Public Health because they're the ones who are collecting that data. One of the biggest challenges that we're finding is some of the labs that are not reporting their information into the state CalReady system. And so we are working through those processes to get that information uploaded to them so that they have most accurate information.
So there are the statewide calls. They're now 2 days a week that county supervisors, cities, assembly, Senate, it's statewide and everyone can go on. Are we having individuals go on and be able to ask directly of CDPH, Dr. I can't think of her name, Kathy, anyways, escapes me right now. But those are questions that you can ask, and it's statewide. Everybody's listening and receiving the same response. So I think if we want to advocate, this may be take some of the language from the letter and be on those calls and ask those questions.
I would ask that if staff works on a letter, that we also ask for some feedback from the state for best practices. For example, is there concern about indoor hair salons, for example, having to do with maybe lack of consistent air circulation? So if fresh air circulation in an indoor environment is highly important for reducing the particles in the air that the customer would breathe, then I think we want to ask for, well, what would the standard be for the cubic feet per minute of air circulation, change out of air be, so that businesses would know, okay, they need to open their windows, they need to have fans blowing. What is it that the state's concerned about these indoor environments, and how would the state recommend to mitigate that? Because I don't think any of us on this in this meeting are personally experts on what would be the safe threshold, and I think we need to push them to provide the best available science.
Okay, I'm going to go to CEO Angelo.
Chair Haschak, thank you. If this board wants a letter drafted to go to the state, that's fine. We will draft the letter and submit any information or any questions that this board would like. Dr. Duhan has been in very close communication with Dr. Sonia Angel, Supervisor Brown. That's the name I believe you were looking for. And so I do know that they spoke even as late as last evening. What I would like this board to consider, though, is Mendocino County is not the only county that is challenged with the state data not mirroring the local data. There are 58 counties, 38 counties on the watch list. There are 20 counties that are not. You know, there was a time, and certainly we were told this, that if you were on the watch list, you got additional assistance from the state. I believe at this point in time, because there are so many counties on the watch list, that may or may not be accurate. I do know Mendocino County is not the only county that has data that doesn't mirror the state. So this is truly a state problem. Now, when you get here locally to what is in the orders that Dr. Duhan has written, and those orders mirroring orders that a county that's on the watch list would have, I think that if you think back, Dr. Duhan did that, one, knowing that our data matched the metrics for the watch list and wanting to move forward so that we would be ahead of the curve, so to speak. What she did do, though, is she put us in a position that we have local control. So I share that with this board to remember that there is local control here. If you are on the watch list at this point in time, there is a good possibility that you will not get off of that watch list for quite some time. The fact that we are not, because of some state problems with data collection, actually benefits us. From what I'm hearing from this board, the issue really is what's in the order. Whether we're on the watch list or not, what's in the order, what businesses are closed, what businesses have to work outside rather than inside. I think those are all questions that we could pose to the state, but I would like to remind this board that we probably need to have further discussion with Dr. Duhan and this board, because at this point we do have local control because we're not on the watch list. And that was specifically what Dr. Duhan wanted. And remember what she said was, because we had orders that matched being on the watch list, that we could change those orders before the state would change our orders because we're not on the watch list. So, you know, I hope I'm making myself clear, but the point is that we have local control. This board and Dr. Duhan could have a discussion about the orders, and if there's any changes that everyone agreed to, we could do it because we have local control. And it's unfortunate about the data. And again, we're not the only county that doesn't have the same data as the state has on that county. Remember, it could take a week to 2 weeks to get results for the lab tests, and then you add that data going to the state. So I don't think when this started that anybody realized the magnitude of COVID. If you think about the testing, the lack of testing, how difficult it is, or the length of time to get a test result back, and you think of 85 sites throughout the state doing all this testing with OptumServe, it really is not surprising that there's challenges with collecting the data and getting the data. Unfortunately, it impacts lives. So again, we will submit any letter with anything that this board wants in the letter, but I think, you know, a little bit of a paradigm shift here is that we do have local control. Thank you.
Okay, thank you. And Christian Curtis, County Counsel.
Thank you, Mr. Chair. So just to add a little bit to what CEO Angela was saying, I want to let the board know that my understanding at the moment is that the state has been taking the position that if you are on the watch list and then your numbers go down such that you're able to stay off of the watch list for a period of 14 days, at that point, you still do not have a loosening of your restrictions from the state. At that point, they consider it to have been they consider the reason the numbers are down to be the restrictions that the state put in place, and therefore what was indicated to me, at least on a call yesterday, was that at that point, if you come off of the watch list, you're still subject to all the restrictions you were subject to before. you simply might not be subject to any additional restrictions that are put on watch list counties. So I do want the board to be aware of that, and just aware in terms of what CEO Angela was saying as to local control. Staying off the watch list has benefited us on that front, in that if the rate of growth stabilizes, there's ability to loosen up at the local level. I also just want the board to be aware. I don't know that I can speak with a perfect understanding of the state's rationale, but it sounds to me like one of the concerns that the board is expressing has to do with the grouping, essentially, of what businesses close indoor operations when. And the latest grouping for watch list counties included things like the hair salons, the nail salons, having to move outside. It also included gyms and places of worship. And I just want the board to be aware. My understanding of where the state has been coming from on this is that it's not necessarily where the transmission happens to be happening in a particular county. It's that they tend to group the industries by risk, rather than where we know that the cases are occurring, because the idea is to be preventing future spread, not just containing outbreaks, which is really more the product of the contact tracing, et cetera. So I just want the board to be aware the state might not find it particularly persuasive that we haven't had, say, a significant number of cases, related to a hair salon or a nail salon, where we have had significant cases connected to other things that happen to be in that grouping, primarily places of worship. So they're looking at sort of limiting rate of spread, and in doing so, they look more at the risk. So in terms of any letter that got crafted, I just want the board to be aware of that, and that it may be good to sort of speak to it through that lens in speaking to the board. Simply looking at where the cases have been so far in the county may not be particularly persuasive to the state. Thank you.
Supervisor Williams.
Yeah, I agree with just about everything said. My issue is I believe the state is wrong. And it's a reductionist mindset to rate these industries and say, well, because hair salons in Los Angeles are a high risk, let's shut them down in Mendocino. I'm looking at my neighbors who see we may be averaging above 15 cases a day. We have to get down below 6. It could be a very long time. We could be into next year. And they have a hair salon with one employee and one customer at a time, and windows open, ventilation, N95 masks, doing everything imaginable, and no spread in our county. And I can't imagine any spread. And yet we're telling them they don't have the right to work. I think we do have a problem. Our curve does look dangerous. We need to address it. But we need to ask the state to work with us to take steps to address the actual problem, not let the problem continue and at the same time penalize businesses that have nothing to do with the spread. If in fact these are high risk businesses, we need some data to be able to show the business owners why we're shutting them down. I haven't seen that. I don't see hair salons being the leading cause of spread in Sonoma County, Humboldt County, Lake County, Glenn. So it may be an oversight. We're 0.2% of the state population. We're being grouped in a way that's just not appropriate. And I think we have an obligation to look at the human element. One of the health concerns is creating homelessness, shutting down businesses, putting people under who have to feed their kids. We can do it if there's a significant risk, if there's data to show that there's spread. But to do it arbitrarily based on what's happening in urban centers, I think needs to be questioned. And whether we do it independently or we work through an association, maybe RCRC, I think we need to carry that message to the state. We at least need to have a conversation to make sure that we're backing our decisions with data. And frankly, seeing that the state in a 3-week period can't enter our total and pointing at labs not reporting data. Well, the data is on our website. We've told the state how many cases we have. Type in the number, right? The upload is somebody hitting 3 keys on the keyboard. And if that's not happening, it calls into question all of the other decisions that are being made on questionable data.
All
So,
right.
handing back to the chair, could we talk about next steps? I don't feel like I need to own this. I'd be happy if another supervisor steps up to write it, or if we give our input to staff and staff writes it, but I'd like to understand what next steps could be.
Well, before we go to any kind of directions, Supervisor Williams, let's go to public comment too. And I think Supervisor McCown. has a
Mr. Chair.
comment.
Mr.
Oh.
Chair, I
Yes.
have not weighed in yet on this issue.
That's why I called on you.
Oh, well, thank you. I didn't quite hear that. So I agree with virtually everything that everyone has said. We have several separate issues, and certainly on, I think, what Supervisor Williams raised initially, the one-size-fits-all approach of the state. And that's certainly something that I've been discussing for over 3 months, maybe 4. It doesn't make any sense. And I hear what County Council says about the perceived risk factors of hair salons, and they're grouped in with these other perceived high-risk businesses. But it doesn't make any sense to be shutting down a sole proprietor hair salon when what's driving our cases are gatherings. So I think we should have a letter that advocates, again, for local control to allow the health officer to make reasonable decisions based on actual data. So we might ask the state, what is their data that supports closing down hair salons? And I can imagine in Los Angeles, you have some hair salons, they have dozens of workstations, dozens of stylists, dozens of customers. That's not our situation. We have many of them, it's a 1 or 2 chair operation. So the issue of one size fits all. I think also the data issue relates to this question, but the data issue regarding what qualifies you for the watch list. So it's true, the state is probably a minimum of 2 weeks, maybe a month behind on calculating their data as to whether we would be on the watch list or not. But we are also behind in our data. And it gets complicated because my understanding is the state is looking at a 14-day period with a 7-day lag. So the data they're looking at, count back 7 days from today, and then count back 14 days. It's that 14 days that they're looking at, but they're not looking at what was reported on those days. They're supposedly looking at the earliest date that someone could have been infected. So the day that someone was tested and then later confirmed positive is what they're going off of. But when we have here locally, as we do, a 14-day or greater lag in getting test results, that pushes us beyond their 7-day lag. So if the state was able to catch up and use current data, it would be incomplete. So there's multiple problems with the data, and I don't know how you condense that into a letter that would be comprehensible. But the state has really helped create this problem with the way they're viewing the data. One thing I want to bring to the board's attention, I'm aware that the city of Ukiah has reached out to CEO Angelo, and they have offered to assist with quite a number of things, including the state data. They're willing to do data analysis of our cases to help clarify what data the state should be using, what timeframes does it fit into. They would like to do, you could call it heat clusters of where our new cases concentrated, to show it graphically on a map perhaps could influence the state. Gee, if 90% of your cases are all in inland and and we've documented it's related to gatherings, why are we shutting down a hairstylist in Albion? Let's see. Well, so a question that I would have there is, I believe we've accepted the city's offer to help with data analysis, cluster mapping. Are we making progress in those areas? Have we actually begun to implement utilizing that assistance?
Well, I guess that's a question for CEO Angelo.
Chair Haschak, yes, Tammy Bartlemay and Becky Emery have connected, and I know that we have accepted their offer. We're actually very appreciative of the city assisting us, and I don't know if Ms. Emery has anything further to add.
Chair Haschak, in addition to meeting with Tammy Bartlemay, we are working through geomapping to be able to identify areas and clusters. We're also working on data analysis together, and Ms. Bartlemay has been a tremendous asset in working forward or working through those efforts. And so we've greatly appreciated the city's partnership and are continuing to try and identify those hotspots and areas as well.
Thank you. All right, going back to Supervisor Williams. Oh, if we're all right now, why don't we go to public comment? Okay.
Mr. Chair, that's fine. I will note I have some additional questions, but we can certainly come back to them after public comment.
Okay. So let's see, Deputy Clerk of the Board, is David Gurney on the line?
This is Atlas Pearson, Deputy Clerk of the Board, and no, he is not.
Okay. Okay, that was the only call-in we had on this. So we'll go and Supervisor McCowan.
Well, I think in rotation, Supervisor Brown might have been first.
Right, and since let's go to one question each on this round, if possible, because we're trying to cut this. So anyway, Supervisor Brown.
I'll pass.
Okay, Supervisor McCowan.
Could we have an update on the outreach to the Hispanic, Latinx, Latino community?
Becky Emery, do you have a response to that? Or CEO Angelo?
Yeah, Chair Haschak, we are, I think we talked about this. I know that we have our contract with North Coast Opportunities, and we have asked them to focus on the Latinx population and also the youth. And they are beginning that process. So I appreciate the question. I wanted to actually get back to this when we talked about enforcement, that we do see this as public health prevention efforts with NCO that has already made inroads into the Latinx population, doing the Mask Up Mendo campaign and outreach and education. So that's the first thing. Secondly, we now have one and soon 2 contracts with Spanish translators. So if you may or may not notice, but when we put out a press release, it takes a little longer because we do Spanish translation. So we are attempting to translate all of the documents that we put out in English into Spanish. We are paying for focused outreach, and I don't know if Ms. Emery has anything else to add. I know that we have our tracers that we are looking at additional Spanish-speaking contact tracers. That would be my update on that. And again, I would go to Ms. Emery if she has anything else to add.
May through the chair, CEO Angelo, you absolutely hit the points that I was going to bring forward as far as our increased translation for timely documents. And also we are training those contact tracers through the Disaster Healthcare Volunteer Network that are bilingual. We received a couple of supports from the state, not as many as we had requested as far as bilingual staff, but we have our staff working with the individuals that are bilingual to be able to increase those supports, and that is moving forward.
Just a quick follow-up, if I may. So are we then reaching out to the Latinx organizations that presented to the board on the 21st?
Yes, and I can
are
see
we
that
working
I've been
directly with them?
too. I don't, Becky Emery, have you been in contact also?
So I know that we are working and continuing those partnerships as we are going to be moving forward throughout the event and implementing additional strategies.
Okay. Thank you. All right. Just since we're trying to end this topic at 10:30, my question would be on the skilled nursing facilities. And Ms. Emery, how are we doing with the skilled nursing facilities right now?
Chair Hashtag. We are continuing to partner with our skilled nursing facility. They are continuing to do diligent efforts to ensure the safety and well-being of their residents. They have partnered with the hospital on that effort, and as well as having regular calls with our health officer, several of the leads within the various hospitals, and the facility itself to come with the best solutions possible to address the situation within the facility and to continue a continuity of care and support to their residents. And really and truly, the MOAC has been a fantastic partner in gaining state support. We had a week of strike team for 5 people supporting that facility and providing staffing as well. And we continue to work together to be able to address the situation as it evolves.
Well, thank you. And that certainly, it's a concern for the whole community about what's happening in those skilled nursing facilities. So thank you for that work. Supervisor Jurdy.
Yeah, and we certainly do appreciate the role of the hospitals with Sherwood Oaks taking some patients out of the Sherwood Oaks and into the hospital. The Coast clinics, and I believe the clinics really throughout the whole county serve, I believe, a majority of all residents in the county. I think I've heard that the Coast clinics serve something like 55% of everyone who lives on the coast at least one time during the year. So they really do have a good ability to communicate with the general public. And so in terms of outreach in the public in general, but also to the Latinx community, I guess I'm kind of hoping that the clinics will have a role in this as well because of just their daily contact they have with so many members of the public. So is it still envisioned that the clinics will be part of this outreach to the Latinx community?
Through the chair, Supervisor Jurdy, we are continuing to partner with the clinics in many, many ways, but certainly they have been a key part for us and outreach to our Latinx community. Specifically, the most recent has been working very closely with the Anderson Valley Health Clinic and partnering with them to ensure that we have good information, that we have contact information, that we're able to connect with individuals that they have become aware of being close contacts of positive individuals. So it's been a really good partnership. It's certainly enhancing and it's continuing to grow. I have to say, I really and truly appreciate that all of the clinics have come forward in partnering and really want to support the effort and response to Mendocino County and all of its residents.
Okay, and Supervisor Williams.
No further.
Well, Supervisor Williams, do you have any further thoughts on what action we should take as far as the next step?
Yeah, perhaps CEO Angela could guide us. Staff deserves praise. This county was not positioned to take on the response to a pandemic, and our staff is working long hours and overwhelmed due to the underlying causes. I don't want to put more burden on staff asking for writing a persuasive piece about why we need more local control and how the state is failing to address our actual problem. But I guess I'd like to hear, is it more work to get the input from the 5 of us and have to deal with us than just writing the letter? And I would raise my hand. I'd be happy to offer a draft and circulate it to the board, however you see fit.
And I guess my question would be, is this something that Supervisor Brown could bring up in some of the conversations where she is on the call with state OES?
I would support that. I would like to get a response from the state. I think if we're putting local businesses under without data, at a minimum, the state needs to explain to us what data they're using to make these decisions. We can't just be giving our input and thanks for your input, have a nice day. I think we deserve a response. Certain generic orders are being imposed upon our county. Why? And if we find out that the why is because of data that's inaccurate, let's fix the data that's inaccurate. I'm not asking for a fight with the state. I'm asking to collaborate with the state for a better outcome.
Chair Haschak?
Yes.
This is CEO Angelo. My suggestion, of course, is always to be strategic when you're dealing with the state, and certainly Supervisor Brown knows that after her many years in dealing with the state. What I would like to do is arrange for a call with Dr. Doohan and possibly whoever on the board is going to be the representative to assist staff with putting the letter together. I'm assuming it's you, Chair Haschak. So I think the first thing we should do is meet Dr. Doohan, yourself, and myself, possibly Chief Counsel Curtis as well, and discuss the conversations that have occurred with the state. And then I think we can draft a letter that could be more pointed to what this board wants and how we can really work with the state to get them to understand our position. I think that, I can tell you from when we started many months ago in trying to get assistance from the state with testing, that the state had a lot of difficulty understanding small rural counties and the positions that we're in. So I would like to have more of a collaborative effort here with Dr. Doohan, yourself, Supervisor Haschak, and we could meet, talk about what the latest is that Dr. Doohan has with her many conversations with Dr. Angel, and then draft a letter for this board to the state, if that will work for this board. Thank you.
Mr. Chair.
Are we in agreement?
Mr. Chair.
Yes, Supervisor McCowan.
Thank you. Well, I certainly have no concern about holding that meeting. I think it's a good idea, but I think Supervisor Williams has been the strongest proponent of this letter with the most pointed questions. I would hope that we would include Supervisor Williams in this meeting to collaborate on what points should be made in the letter.
Yeah, and that sounds fine with me. County Council.
Thank you, Mr. Chair. I just wanted to add on a little bit to what CEO Angelo had said. My observation has been that where we have gotten traction with the state in explaining the needs of rural counties has been where we've really been able to educate them as to the differences between the urban counties and rural counties, and really be able to point to some of the specific differences in the way the businesses operate here, or that people's lives here are different from in a more urban setting. And I will say, as Ms. Emery had said previously, I think Dr. Doohan has actually had a remarkable level of success on that front, as challenging as it may have been. So one area that may be helpful for any letter is, to the degree there can be either input from the industry or input from the supervisors as to specific differences in what these businesses look like in a rural setting and how that relates to the safety concerns and the risks that the state is looking at. I think that will likely make a significant difference in the persuasive value of any letter that's crafted. Thank you.
Chair Haschak, this is CEO Angelo again. I don't know who will be assigned, if it's you, if it's Supervisor Williams, if it's two of you, it doesn't matter. that would be fine. What I would ask though is that this board be very, very clear what you want as an outcome so that we can draft the letter specifically focused on the outcome that we want. Thank you.
Chair Hascheck.
Yes, Supervisor Williams.
So that we can represent the board as a whole. I think what we want is either local control to allow our health officer to set restrictions based on actual risk and actual cases, or we would like the state to do the same, set restrictions in our county based on where we have actual cases or we have documented and justified risk. And I think we're probably not alone. I imagine there are other counties that are seeing this one size doesn't fit all. And maybe this is a way to kick off a discussion between the counties and the state. And I think it may be valuable to pull RCRC into the process. We don't want this to be a fight. We want it to be about collaborating with the state to make data-driven decisions. Our argument is the decisions are not backed by data today.
Chair Hascheck, I'm sorry, it's getting late in the hour here, so I want to just comment. We always want local control. Those two words are embedded in anything we do, whether we're working with the state, CSAC, RCRC, at the federal level, we always want local control. So if this board wants to move forward with a letter focused on local control, I think that would be optimal. Additionally, I will say, as this board knows, I do a lot of work at the state level because of the association I'm in. And RCRC is not that intimately involved at this point. It is CSAC. CSAC is absolutely at the table with the state on all of this. And so CSAC would be the organization we would work with. RCRC, we would certainly notify them, but it would be CSAC. So I would make the recommendation to this board that we focus on local control rather than anything else. And if we're going to work with a statewide association, that it would be CSAC first. Thank you.
I can support that.
I guess my question would be, if we're not on the watch list and we have local, why would we need to write a letter to the state demanding local control? We want greater control over some of the businesses. I think that would have to be something that we would work with RCRC and similar counties, because we would all have the same situation like County Council said.
Chair Hascheck, as I see it, today we have local control because we're doing what the state would demand for us to do. But if we make any changes, the state will take away our local control. So it's only local control in theory. We have it until we exercise it and then we lose it. Well, that's not the right predicament to put rural counties in.
Mr. Chair, if I
Okay,
could.
so let's wrap this up. Supervisor Williams, tell us what you think is happening at this point.
I think you are taking responsibility for authoring a letter, taking the burden off staff, allowing me to contribute some points to it. And are we bringing it back to the board next meeting, or are we submitting it? Do we have support from our colleagues to trust our judgment and submit the letter?
Mr. Chair,
Yes, Supervisor McCowan.
I support directing that or authorizing you, Chair Hascheck, and Supervisor Williams to work with staff to draft a letter and also to authorize you sending it subject to it's what the two of you as our board representatives agreed to. But maybe it's more than one letter. So I think this issue of requesting local control for the health officer to make decisions based on local data and her professional judgment, knowledge, etc., That's really a key topic by itself, I think. So we would want local control for the health officer to use our local experience in consultation with the state. That's fine. But let's have our health officer have the ability to say it doesn't make sense to shut down the hair salon because somebody had a party in Calpella. Another letter could deal with the data issues related to the watch list. So there's a distinct lack of clarity around what data is available, what data is the state currently tracking. One issue, and I believe County Council mentioned that his understanding was that even after your numbers go down for a 14-day period, again, I believe with a 7-day lag, you wouldn't necessarily come off the state monitoring list. I believe that I read in the information from the state on the state monitoring list that after your data showed that your case rate had dropped below 100 per 100,000 for 14 days, that you would come off of the state monitoring list. So we need clarity on that, exactly what criteria are being used. I think we need to know also, how does the state calculate that we're supposed to be on the watch list when they say they're using a 7-day lag, and yet we have a 14-day lag in getting test results. I think these are related in a way, but distinctly different enough that maybe we should have 2 letters, or if we only have one, I would focus on the local control for the health officer issue.
I think what we need to do is Supervisor Williams and I need to sit down with the CEO, with the public health officer, see where we are with these communications and see what we can do as far as this discussion we've had today.